I'm an Ayurvedic doctor by background. But I work with NHS. I'm the program director of NHS at the moment. And like the insight been offered by Dr. Mehta and Dr. Sanjay Kumar. What I'm talking about, a lot of things have been already mentioned in this today's discussion so far, so I don't want to repeat many of them. But what I want to talk about is how complementary medicine or particular Ayurveda can be integrated into the mainstream perspective, and what can be done from health policy or mainstream side of the things. So there's a lot of evidence for lifestyle medicine, as Dr. Sanjay Kumar did say, and how it aligns to Ayurvedic principles so far. And my experience working in the NHS from the management side of the things, commissioner side of the things, is that there are a lot of opportunities for the NHS to make that change, make change very effective. And I think that today's discussion and the outcome from what we do today will really help to share that policy for the NHS in so far. So obviously, where I see the opportunities lie, I mean, obviously, like previous speaker has kindly spoken about, is where prevention can be, that can be opportunity changing the lifestyle. And my observation since working in the NHS for the last 20 years, what I've seen is the few changes in terms of the clinical complexities doctors see these days. 20 years back in the GP's surgeries, the kind of patient you saw and the kind of patient they see now, right, is vastly different. Secondly, the aging population and the patients are living longer, so their lifestyle illnesses are also being longer. And thirdly, which are also been pointed out before, is there's a disconnect between what people eat, whether they have good sleep, whether they manage to stay there better in their life, and their problem. And I think what we do treat as an NHS, and I'm sure people who work in the NHS are familiar to that term, is firefighting. So I will say we are firefighting and all that, and we try to do the things as they come along. And so what NHS has become is a reactive organization. So if you have epidemic, we put a place, programs to deal with that. If you have anything complex, we throw money at it, we throw resources at it, and all that. And we look at where at the same time we're looking at reducing resources, making it more efficient, and things like that. So what we did is from the supply side interventions, we look at how we make the supply more efficient. But what we do not do, the NHS, is look at the demand side, where the demand is coming from, why is the demand coming from, what are the factors that is rising to it. And this is where I think the opportunities for Ayurveda with a lot of scope into it. I'll give two examples. Probably my colleagues might not agree with that, but the two things, we did a major project in the NHS, I think 12 years back. And the title of that was identify medically unexplained symptoms. And the reason for that, many of our doctors, consultants, or the GP colleagues told us, they see a lot of patients who tell them symptoms, but they're not clinically correlated. And then this patient gets frustrated, and they have to arrange a CT, MRI, water bloods, and all that. And that waste a lot of NHS money. So we decided to look at, I was working in the local commissioning group that time. And we looked at it, we looked at that, when we looked at all the symptoms, around 27% of the symptoms were classed as medically unexplained symptoms. Then we further declassified that into the specialties and saw what were the symptoms were. So one of the factors, and this was on science, many of the symptoms, then patients were having them, but from the clinical community didn't think there's anything worked out. But when these symptoms were then addressed by then the outcomes were better for them. So I think that was a learning from that. So secondly, the learning for me, because I worked, I'm Ayurvedic doctor myself, and I looked at that and I saw these symptoms, well, they are not connected with the problem that we see in the consultant for. But these symptoms, one of the symptoms I can tell you about was many of these 5 specialties that we identified, one of them was orthopedic. And one of the symptoms that was not connected with their specialty was excessive worry. So those patients were complaining of excessive worry, excessive worry. A lot of patients were complaining of that. There's no connected to it. But when I looked at it, and then I found a citation which that excessive worry with chinta was one of the reasons for chronic low back pain. And this kind of struck me that if we do something about the symptoms, if you look at the whole system holistically, can medicine like Ayurveda, oral aesthetic medicines can help in this? Because those patients, then they bounce off and they don't get any care. And then these patients then kind of end up in hands sometime later on. Another thing from my perspective, I would say, is we focus, of course, the health system, as you said, Dr. Singh Kumar, a lot of patients are in hospitals struggling to get a bed, and when they get the bed, they're struggling to get discharged from that. So 75% of the beds are occupied by people over 65. And now, obviously, the system is geared towards that, looking at how to reduce the hospitalizations and things like that. But what we don't do properly very well is that why patients reach into the situation in the first place. Why can't we do something that when the patients get their illnesses, say in early 30s or mid 40s, that they don't get that bad, that they end up in hospital. And if they do end up in hospital, they can't be discharged back to their home. And this is where the lack of preventive thought, I guess, is important. This is where the focus of Ayurveda on AHA, diets, lifestyle, and prevention, and all the things can put in the picture. And this is where I guess the NHS can help with that. Another point which already been talked about is the mental health and how these small things relatively can impact the mental health. Like I said, if the stress is there, I mean, we do the work with our GK colleagues and consultants. We ask your patients, did you have a good sleep last night? Do you have a stress in your life? I mean, what is your workplace stress and all that? I mean, these things are managed when the patients report them to the doctors, or they become excessively complicated. But going from the point of view, if we nip them in the bud by focusing on that will help you a lot. So I think there are a lot of opportunities here. But going forward, what I would suggest is maybe drafting some kind of pilot studies, initially working with the local GP colleagues. Maybe maybe there's a lot of empirical evidence available as to where Ayurveda can help most. For example, musculoskeletal problems are one of the biggest problems at the moment. 50% sick leaves are because of musculoskeletal issues, then psychology issues, low mental health, and all this. So I think though, if we identify as a group, where are the opportunities to work together, then we design some kind of pilot studies, then run the pilot studies on a small scale, and then depending on the results from that, then that can be kind of pitched towards the regional authorities or in the national NHS England on a national level. So there are quite a few things, and I'm happy to support any work that can work on this.